5. Hi, this presentation is about obesity, what it is, its effects, possible causes, and things that can be done to prevent and/or treat it. People are considered obese when their BMI exceeds, or BMI means body mass index, exceeds 30 kilograms per meter squared. Factors involved with obesity are things like biological factors. And this would be like when a person has a genetic predisposition to a lower than normal metabolic rate, or how much fat they store or where they store it. Psychological factors are things like a poor body image, which can lead to a mindset that makes it difficult to make needed changes. Environmental factors include things like eating habits, activity levels, medications, things like that. Obesity is the leading cause of preventable death worldwide. More than 1/3 of the people in the U.S. are obese, another 34% are overweight. 20 years ago, no state had an obesity rate above 15%. Today, there are 41 states that have rates over 25%. And if obesity rates stay consistent, 51% of adults will be obese by 2030. In one generation, obesity has gone from a medical and social issue to a public health disaster. Rates of obesity vary based on things like region of the country. Of the states with the 20 highest adult obesity rates, only Pennsylvania is not in the South or the Midwest. For the first time in 8 years, Mississippi no longer has the highest rate. Louisiana at 35% is the highest, followed closely by Mississippi at 34%. Colorado has the lowest obesity rate at 21%. That's where I'm from, yay Colorado. Rates vary by age. Obesity rates for baby boomers, those who are 45 to 64 years old, have reached 40% in 2 states, Alabama and Louisiana, and are 30% higher in 41 states. By comparison, obesity rates for seniors, those who are 65 years and older, exceed 30% in only 1 state, Louisiana. Obesity rates for young adults, those who are 18 to 25 years old, are below 28% in every state. More than 35% of adults ages 26 and older who did not graduate from high school are obese, compared with 21% of those who graduated from college or a technical school. More than 31% of adults ages 18 and older who earn less than $25,000 per year were obese, compared with 25% of those who earn at least $50,000 per year. Rates by gender are now consistent. This wasn't always the case. 10 years ago, there was nearly a 6 percentage point difference between the rates for men and women. Men were at 28%, women were at 33%, and now the rates are the same for both sexes at 36%. Men's obesity rates have been climbing faster than women's for the past decade. What are the costs associated with obesity? Annual healthcare costs related to obesity in the U.S. is nearly $2 billion annually. 21% of all medical costs can be attributed to obesity. Per capita medical costs are $2,741 higher for people who are obese compared to individuals of normal weight. And full-time workers in the U.S. who are overweight or obese and have other chronic health conditions miss an estimated 450 million days of work each year compared with healthy workers. And this number seemed incredibly high, so I cross-checked it with a variety of sources, and they all came up with this number. This absenteeism, or these missed days, results in an estimated cost of more than $153 billion in lost productivity annually. Medical expenses for obese employees are 42% more than for a person with a healthy weight. But obesity doesn't only affect economics. 572,000 Americans die of cancer each year. About 1/3 of these cancer deaths are linked to excess body weight, poor nutrition, and/or physical inactivity. Over 75% of hypertension cases are directly related to obesity. And approximately 2/3 of U.S. adults with type 2 diabetes are overweight or obese. Amputations and blindness that are associated with diet-related diabetes, as well as strokes and osteoporosis-related hip fractures, may lead to a loss of independence. And people are less likely to participate in the things that they enjoy or love if they are obese. How do we get so fat so fast? Is it our food? Food Valley is a region in the Netherlands and is the research center for a large number of food multinationals and is like the Silicon Valley of the food industry. 15,000 professionals are employed here and are active in food-related science and the manufacturing of food-related products. The aim of their work is to formulate foods. For example, crispy foods carry a certain appeal and are engineered to have a certain amount of crunch because this symbolizes freshness. Researchers have found that rats addicted to junk foods have behavior similar to rats that are addicted to heroin. A study of the effects of junk food showed that those rats that were continually given this type of food had pleasure centers in their brain that became less responsive as time went on, causing the rats to consume more food. This suggests the rodents became habituated to the food and ate more of it to receive the same amount of pleasure. Was the food engineered to cause this? Commonly consumed soybean and corn oils contain components that can be converted by the body to produce endocannabinoids, which are similar to the appetite stimulants found in marijuana. Sugar, fat, and salt have all been linked to overeating, and the food industry tries to pack as much of these three components into food to maximize their flavor, which increases the likelihood that the consumer will purchase more of their product. In a study of 65 cereals in 10 different grocery stores, Cornell researchers found that cereals marketed to kids are placed half as high on supermarket shelves as adult cereals. The average height for children's cereal boxes is 23 inches versus 48 inches for adult cereal. Another significant finding from the same study is that the average angle of gaze of cereal spokes characters on cereal boxes marketed to kids is different than those cereals marketed to adults. Figures on kids' cereal boxes look down at a 9.6-degree angle, where spokes characters on adult cereal boxes look almost straight ahead. Should parents buy cereal for their kids? They don't always know what to do. Food companies use terms and phrases like organic, whole grains, and fiber to influence parents to purchase their product. The food is not necessarily healthy, it just has some healthy sounding words on the box. But the food companies are not solely responsible for obesity. What have we done to ourselves? Diet and exercise are the mainstays to prevent and/or treat obesity. 80% of Americans don't get the recommended 150 minutes of moderate intensity exercise per week. Americans consume 31% more calories today than they did 40 years ago. Consumption of food away from home plays an increasingly larger role in the average American's diet. In 1970, 26% of food spending was on food away from home. In 2012, it was 43%. Between 1977 and 2008, the number of calories consumed via food away from home increased from 18% to 32%. Factors that are contributing to the increase in the consumption of food away from home are things like more women employed outside of the home. Consequently, it generates typically two incomes. More families can afford to eat out. Fast food is affordable and convenient. Think about drive-thrus. I mean, we don't even have to get out of our cars. We just get food delivered right to our laps. And there are more available fast food outlets to choose from, and they do a great job of promoting their product. We all know about them and their specials and all that kind of stuff. If exercise and diet are key to preventing and treating obesity, what policies can be put in place to help people make better choices? The beverage tax. The sugar-sweetened beverage tax involves charging a small tax to sugar-sweetened beverages, and these tax revenues can be used to make healthy food both more available and affordable. Nutrition labels on menus at fast food restaurants. 75% of people claim to read these labels and say it is involved in what is purchased. School food programs, like the National Lunch Program and the Fresh Start Fruit and Vegetable Program, get food to those who need it most. Require physical education, nutrition, and cooking classes in schools, which is interesting because many of these programs existed in schools but were eliminated or reduced around the time that obesity rates started to increase. Ban the marketing of junk food to kids, just like they banned tobacco ads and hard liquor ads on TV so kids would not be exposed to these things, and also ban the marketing of junk food to schools. The USDA is trying to do this and has met a lot of resistance from the food industry because the schools are a significant part of their business. After researching this project and doing all the research for it, and it's always been something that's been real interesting to me, I've realized that obesity is an incredibly complex issue. And this was very informative, but I really don't know where to start. But I found this really super sweet quote. I heard a saying that, well, here it is, that obesity is typically a problem of affluent nations. And so this quote by Alan Craig, the Rockefeller Center Foundation, I think says it all. Thank you.